Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Homeopathy. Now coming into the structure and functional part of the uterus or the female reproductive organ. So why should you know about the structure and functional part of the female reproductive system is that, say if you know the basic things, you will know where it is going wrong and how it is going wrong and how can you prevent it if you are a female who hasn't experienced this, how to prevent it, and if you are a female who is experiencing this, how to cure it and relieve it. So let's get into the topic. So this, as you can see, is the female reproductive organ. These are the ovaries. This is the fallopian tube. This is the uterine part, and this is the cervical part or the cervix and the vagina part. Okay. So the ovum usually is released by the ovary. It is picked up by the fallopian tube and it will stay here. Okay. So what happens if there is intercourse? The sperm has to travel here until here and meet the ovum. Okay, and then when the ovum is met with the sperm, it will become a zygote, that is a living cell which will be able to divide. And when there is certain division, it should come down and attach here. You understand? It should attach here. Okay, and then after attachment here, it should grow big, and then there is delivery. But it does not happen regularly, right? So what happens when the ovum is released and it stays here? It stays for the sperm, and when there is no fertilization, that is when there is no sperm meeting with the ovum, there is no zygote formation. And what happens is when the uterus is always prepared for pregnancy, that is what happens, there is 30-day cycle, right, or your 28-day cycle. What happens is that first day of your period to the 14th day, and then from your 14th day to the next day of your period, there are two phases in it. Okay, the first phase is called as the follicular phase, the next phase is called as the luteal phase. In both of these phases, what the endometrium will do is that is the lining of the uterus, it will become thick so as to be prepared for pregnancy. When this zygote is not forming, when there is no fertilization, this endometrium which has grown thick so that it will carry the baby, because the baby is not there, it will start to come down, which is menstruation. Okay, when it is coming down, it will have certain chemicals released, that is why there is pain. Okay, so we will explain it in the body changes part, why there is pain in the primary dysmenorrhea and why there is pain in the secondary dysmenorrhea. If you're someone who is experiencing pain during every menstruation and you want to decrease it, that is primary dysmenorrhea. And if you're someone who is experiencing pain along with other abnormalities in your flow, that is secondary dysmenorrhea, and you would like to get in contact with us, we have two kinds of consultation options. One is the online consultation, the second one is the offline consultation. If you're someone who is staying nearby the nearest branch of Fidicus, you can come and contact us in person. If you're someone who is staying far away from us, you can contact us online. We have two options, that is audio consultation as well as video consultation. After the audio and video consultation, if we think you are suffering from secondary dysmenorrhea, we will ask you for investigations, or if you have already done investigations, you can send it to us. And after the doctor consultation and after the whole process is done, your medicines will be delivered to your doorstep. That is home delivery option is available, where if you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days. And if you're staying anywhere else, it can take 4 to 8 business days for our medicine to reach your doorstep. If you want to consult us, you can call us on this number. You can WhatsApp us, you can message us, or you can call us. If you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. So if you're someone who is experiencing painful menstruation and you do not know what kind of painful menstruation it is, that is primary or secondary, or if you're someone who is experiencing pain in every menstruation and you would like to get rid of the pain to have a better work-life balance, or if you're someone who is experiencing pain along with the abnormalities, that is female reproductive problems, you can contact us. And also, why should you choose Fidicus Homeopathy? Because Fidicus Homeopathy stands for highest chance of health. Here we have three principles. One is the highest success rate. See, we are already experiencing a rush of patients who are approaching us for different female reproductive problems, and the success rate is really high. It is good. And also, there is transparency in treatment. That is, that there is no gray area between the patient and the doctor. Any sort of prognosis that you should be knowing, we will be letting you know. And also the personal care here at Fidicus. If you have any sort of myths, or if you have any sort of queries regarding your own problem, we will be educating you. And not only that, we will educate you in all aspects of your problem. So if you want to choose cure, if you want to choose a better life, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.